Welcome back. Well, we all know our ticket out of this pandemic is vaccination, but there is much, much more that we don't know, like when we might get it and what our lives will look like at that point. So, here to answer our most pressing questions about COVID-19 vaccines is infectious disease expert Dr. Zain Chagla. Welcome to the show.
Thanks for having me.
What a great day to have you with us because the most recent information coming out of Israel, who many people will argue is really far ahead in the vaccine game with over 70% of their population vaccinated. Their newest study is showing 94% decrease in symptomatic COVID-19 cases as a result of the Pfizer vaccine. So A, what do you make of this? And B, what should we make of this?
So, as you said, Israel is the perfect public health experiment into what happens when you vaccinate a large population with these novel vaccines. And it's showing. They took 600,000 individuals, matched them against 600,000 individuals who hadn't gotten the vaccine, and saw a 94% reduction in symptomatic COVID-19. And to put that into context, that was the same number that they saw in the original Pfizer clinical trial of about 45,000 total individuals. To get a vaccine that, when it's going into a real life population, particularly those who are elderly, as well as a lot of B117, the variant originally derived in the UK, circulating in that population, and get the same effects, that's an incredible win. This is actually hugely promising for the vaccine rollout, that it's going to have significant benefits to society. And we're seeing it in Israel right now.
Okay, but Dr. Chagla, we are not in Israel. We are in Canada. And I think we have been watching sort of like this bouncing ball, trying to figure out when exactly we can expect to get it. So when can the general population, reasonably assume that they will be in the queue to get vaccinated?
Yeah, I mean, it all depends on where exactly, you fit in terms of your age and medical criteria and exposure criteria. We do know much more Pfizer and Moderna vaccine is coming in the next 6 months. The expectation is everyone who needs a vaccine has access by September. But I think public health programs now across the country are starting to work on their community dwellers. So people of a certain age outside of long-term care, and gradually working down to people of, over the age of 65 with medical conditions and who have very front-facing professions. So if you belong to those groups, you're probably going to be seeing the vaccine in the next 3 months. If you're kind of a healthy, under the age of 65-year-old, probably towards the summertime. And again, as we're waiting for more data on children, it may be a little later than that for that.
So it sounds like, our vaccination rollout is broken down into stages. And so currently we're in stage 1 of that rollout. It is prioritizing frontline healthcare workers, long-term care workers, and residents, for example. Stage 2, then focusing on other essential workers. Then there's stage 3. If you are, stage 3 sounds very broad. I guess it's the catch-all for like the everybody else category. Mm-hmm. How do you think that they're going to break down further that stage 3 category so people can really reasonably say, oh, I'll probably not be getting mine until, X time?
Yeah, I mean, I think you mentioned exposure risk. And so if you fall into a profession that needs to be front facing, those who work in healthcare, in police and fire, and teachers, and grocery store workers and other frontline agents, then they're probably going to be a little bit earlier than the general population. Age is probably the biggest factor more than anything else. And that is really kept throughout multiple studies of who has complications from COVID-19. Those over the age of 60, 70, and 80 have increasing risk. And then other comorbidities, if you have heart disease, a history of pneumonia, disabilities, where you may be prioritized a bit earlier. Again, if you're kind of in a healthy under 40 bracket, you're probably going to be latest in that line of stage 3. Not to say that you're not going to get the vaccine, but it's going to be prioritized to those people where waiting that 2 or 3 months may mean more complications and more death, which is obviously what we're trying to prevent.
You mentioned children, and currently there isn't a vaccine yet that has been approved for kids. So when could we maybe think that they might be safely vaccinated?
So the good news is there are 3 clinical trials from Moderna, AstraZeneca, and Pfizer looking at children. They're smaller than the ones that were done for adults to approve these vaccines. The hope is at least when enough children enroll, and some of them have actually completed enrollment, they show the vaccine is safe. They show the immune response is pretty similar to that of adults, and it shows that it does decrease symptomatic COVID-19 in that population. Then these vaccines will be approved. It's not clear what the entire age cutoff will be, but I think we're going to probably see those over 5 and up to the age of 16 to 18, depending on the vaccine, being covered when these clinical trials come out.
Okay, so you were talking about ages and phases and stages. And so let's say, for example, our parents, because they're older, will qualify for vaccines ahead of, let's say, us, their adult children. So here's one of those questions that I think a lot of people are asking. If our parents get vaccinated, but we are not yet vaccinated, is it safe to see them?
Yeah, it's a good question. And the answer is we don't know just yet. And the reason is these vaccines have been proven to reduce symptomatic COVID-19. They've been proven to reduce hospitalizations and deaths. They're not perfect. And so people can still get COVID-19 with these vaccines. And we don't know what it does to transmission. And so, while there's still caution here, so for now, wait till everyone gets their vaccine for those close, high-risk interactions. But we may learn more in a couple of months that may make it much more reasonable for the people to be vaccinated to engage more into society.
I feel like there are more and more reports that I'm seeing, at least, about the variant strains, and the suggestion is that maybe some vaccines might not be as effective to protect against them. What should we be concerned about?
So, number one, I think the overlying theme to all of this is most of the vaccines out there, including the AstraZeneca vaccine, which has had a little bit more controversy around the variant strains, particularly the one deriving in South Africa, still protect against hospitalization and death. And so that is still a win. And the right vaccine is the one that's administered to prevent that complication. As we're starting to talk about symptomatic COVID-19, there are discrepancies between the vaccine. AstraZeneca, particularly in the South African variant, did not perform very well in people who had symptomatic COVID-19. It doesn't necessarily mean that the severe patients weren't protected, but for the average person, they didn't reduce the amount of symptomatic COVID-19. The good news is the other vaccines, Johnson & Johnson, Novavax, both have had effects in that variant and reduced hospitalizations and deaths. Pfizer and Moderna have not been tested in terms of clinical data, but lab data suggests that their response is almost the same as other variants. The other good news is the B117 variant, the UK variant, it seems like all of these vaccines work very well against them. And we're actually seeing that right now in Israel, which is about 40 to 50% B117, that they're seeing this successful campaign in the context of it circulating.
So experts are now saying that we're going to have to learn to live with COVID. What does that mean exactly?
So it's important. We have many different respiratory viruses. And again, they come during the year. We do see people hospitalized. And it's unfortunate, but it's the reality of the situation. COVID has really gotten to every corner of the earth, and it's going to be incredibly difficult to eradicate it. But between vaccinations, novel treatments, and the knowledge we've amassed over the next year and the year to come, we will likely have a disease that is much, much less fatal than it is now, much less of a health systems problem than it is now, and likely something we can live with as part of the many other infections we deal with in the winter season. It's not going to be perfect, but I think knowing where we are now, we probably will have a much, much lower risk of all of us being sick with this, as well as a lower risk of hospitalizations, deaths, and some of the destruction we've seen in long-term care.
Dr. Zain Chagla, thank you so much for your insight and wisdom today.
No problem. Thank you for having me.
Don't go anywhere. We'll be right back.